My name's Dhalia Masud. I'm one of the plastic and reconstructive surgeons. Now, I'm joined here by Hannah. So, Hannah, could you introduce yourself and tell us what your role is?
I'm Hannah. I'm a breast reconstruction specialist nurse. I work for the Norfolk and Norwich Hospital. Basically, my role is to support women that are going through reconstruction, normally due to breast cancer, that need a mastectomy, and help them through the journey decide what's the best choice of reconstruction. I'm mostly focused on education preoperatively and looking after them post-operatively as well. Reconstruction is a bit like running a marathon, so you need lots of information, and I'm that point of contact, and I would be your key worker to support you through this journey.
Brilliant. And that's exactly what it is. With reconstruction, it is a huge team that we have to coordinate. And Hannah will probably be your first port of call for many of the questions that you need. When will my operation be? What kind of things do I need to bring in? And if Hannah can't answer the question, she'll be able to divert you to the right people. Now, today we're going to focus on preoperative or pre-surgery assessment and what to do to make yourself fit for the surgery. Now, one of the things that we always emphasize on is ask as many questions as you need. There's lots of information out there. Can you tell us a little bit about the information that such should be going to?
I would always look for reputable sites. We actually have a charity that we work really closely with called Keeping Abreast, which is specifically a breast reconstruction charity. That website is a fountain of knowledge, and they also do a group meeting where they do a show and tell. Can't emphasise how useful and important this is, because you're talking to other women and actually seeing their results from their reconstruction. I would say looking at websites like the BAPRAS or Breast Cancer Now, and also just talking to other people that have had reconstruction is really important. I would always say just always make sure you specifically follow your surgeon's advice, just because things can differ from each hospital or each country as well.
And I'll put some of the links down in there at the bottom of the YouTube thing, so you can get in contact with the various things that Hannah mentioned. Now, in terms of information, which we've talked about, what are the physical things that you advise patients to do, or we both advise patients to do, but you emphasise on as well?
So I think what's really important is to be as physically fit as possible. So we said running a marathon. Of course, I'm not expecting you to do train as if you're running for a marathon. What's really important is that even if you just increase your activity just a little bit, that will make a huge difference to your recovery. If you're a patient that's maybe considering having delayed reconstruction, that does give you a little bit more time to optimise. So we definitely focus on core work, things like Pilates and things like that. That can really help strengthen your core and help with that recovery, especially in the sort of abdominal area if we're focusing on the DIEP. Really important that your BMI is under 30. We just tend to find that ladies with higher BMIs, they tend to have a lot of wound complications. So we do have quite a strict criteria with that. And it's really important to make sure that you're not smoking or vaping or using any nicotine products. And that's normally for at least 6 weeks before. We say that because smoking can really affect, again, wound healing. And it can also lead to risks of the blood supply not working because the little clots. And we do often complete a smoking test as well at your pre-op assessment. There's lots of support out there to support you with this, but that is something we'd consider. Another thing that we really focus on is making sure you're prepped with your deep breathing exercises. So as soon as you wake up from your surgery, you're going to do this sort of ACBT breathing, which is basically a couple of deep breaths and a couple of huffs. We've got lots of leaflets and things about that. And it's really important you start doing those, because as soon as you wake up, we want to help re-expand the lungs and prevent any chest infections. And we don't want you to wait for us to prompt you. We want you to be able to do that as soon as you wake up to help with that aspect.
Great. Patients come with very close family members. It might be a brother, it might be a husband. What kind of advice would you give close family members when it comes to preparing for a reconstruction, particularly with the DIEP?
So I really think it's important, especially the first week of your sort of post-op recovery, that you're prepared to be looked after. You're not going to be bedbound per se, but you're quite limited on what you can do. So, you're going to be able to potter around, pop the toilet, things like that, but nothing really much more than that. So it's really important for the first week at least to have someone with you 24 hours so they can care and support you. And also for sort of psychological support.
Absolutely.
I think it's really important also just to focus on the fact that although it's the patient that's going through the reconstruction, relatives are affected as well. They're always welcome at Keeping Abreast meetings and just get that kind of support, because it does affect the supported person as well. And you're more than welcome to come to appointments and one-to-ones and things like that with us, so we can support you as well.
Yeah, absolutely. I think that's really important. When I do my consultations, I will try and encourage family members to come and listen in, so they know what to expect, what their family member is going through. And also in the reconstruction forums, I recommend online that the family members join on Zoom, etc., so they know exactly what to look out for, what not to look out for, because patients themselves are going to be in a very difficult, compromised position after the surgery. And when you have someone or a second pair of eyes, it's just nice to have that reassurance and that care afterwards.
What I would always say, though, is definitely, because when you're in hospital, we're monitoring you for any risk with the blood supply. So I would say it's quite an intense kind of time when you're in. We're monitoring you very closely. So of course you can have visitors, but I would say just limit the amount of visitors, just because actually, that's going to be the time you're recovering. And even in those first 2 weeks, I know lots of people want to come around and help and things like that, but actually it's really important that you're using that time to focus on you to recover.
That's great. And in terms of consultations when patients come to see me, after they go, do they ever call you about any questions? And if they do, what's the most common question that they wish they'd asked me as a surgeon
I think quite often is they want to know about scar patterns. I think sometimes they don't always remember some of the things we say. And about size is a really important one.
Yeah.
And I think the other one is really how quickly they can get back to their sort of normal routines, or if someone's very active. So a few of ladies we've worked with, they've done sort of quite high impact sports or running and things like that. It's always the question they always forget to ask is how quickly they can get back to normal activity.
That's great. So what we will do over the coming sessions, we will focus on scar pattern, how quickly you can get back to work, and other issues. If you do want us to answer any questions, let us know, and we will design a talk specifically to what you want. So thank you very much.
Thank you.
All
Bye.
right, bye.
Bye.